Have you noticed that more and more people on social media are looking younger and younger in facelift before and after videos? In this video, I'll talk about the premenopause or perimenopause facelift and why it's becoming so popular. I'm Dr. Sarah Saxon, double board certified facial plastic surgeon. In my training, most of my mentors told me my practice will age with me. And that made sense. As you're younger, you mostly get younger patients for things like rhinoplasty or minimally invasive treatments, things like face tight, fillers, any kind of radiofrequency treatments to tighten the skin, lots of like buccal fat pad excision, things like that. But I've found that as I've gotten older, as I am myself in perimenopause, my patients who I've been seeing for 10 years now are now aging with me, and they're ready for a facelift, as am I. So before a deep plane facelift came along, most people thought of facelifts as looking really unnatural. You look really pulled. This was like, you thought about Joan Rivers, people that noticeably had a facelift. But now that techniques have improved, we're seeing more and more younger women do it because it looks really good still. But also, a lot of these minimally invasive devices people are finding out that they don't work as well as they want them to, and they don't have as much longevity. So we're now in an era where people are wanting more long-lasting results, and they don't want to damage any tissue underneath. And quite frankly, there are a lot of med spas out there doing these minimally invasive treatments that are causing a lot of harm. So understandably, people are now wising up to this fact and coming to surgeons a lot younger, saying, I don't want to waste my money on all that other stuff. I'd rather just do a facelift. And so we're seeing this in patients in their 40s, sometimes late 30s, but for sure 50s. Women are no longer waiting until they're in their 60s and 70s to get a facelift. And understandably, there's a lot of pressure in the media right now to look perfect with filters, and a lot more women are in higher profile roles in their companies. And the dirty truth is how you look really matters and how people treat you as a woman, which is unfortunate, but it's not the same for men. Men can age without doing a whole lot, and they get viewed as wiser and more mature, whereas women get pushed aside if they don't keep up with their looks. So it's not necessarily bad to get a facelift early on if your anatomy warrants it. Now, different women age at different times. The thinner skin that you have, the faster you're going to show signs of skin laxity and jowling and that sort of thing. I tend to see African American and Asian women age a little slower because their skin's a little thicker. But if you have skin like mine, even if I'm doing treatments all the time, and I do laser treatments and Morpheus 8 and all the things, to constantly try to build collagen, you start to lose about 1% to 2% of collagen and elastin in your skin about every year starting in your 20s. So that over time catches up with you. Now, things that speed up this process are things like the sun, smoking, any kind of free radical damage in the air. And then one thing that has been even more of an issue lately is rapid weight loss. With the rise of GLP-1s like Ozempic and Wegovy, I'm seeing more and more younger women, even in their 30s, after they've lost a lot of weight, start to get early signs of aging with skin laxity. So just like having to do a tummy tuck or an arm lift after rapid weight loss, sometimes you need a facelift too. So there are some situations where I feel like having a facelift at a younger age is demonized, but everyone is different. So I don't approach everybody with the same standards because their life situation is very different. The good thing about doing a facelift earlier on, rather than waiting till you're older, is that you haven't lost so much collagen and elastin in the skin to make it hard to redrape all the tissues. So I find that you heal a lot quicker. It looks a lot more natural because the skin's not tissue paper thin, and you can still get a very long-lasting result. And if we were doing these mini lifts or smash facelifts, it would be different. You'd probably need another facelift in a couple of years. But with a deep plane technique, it really lasts a long time. And if you're keeping up with your skin, again, with like laser treatments or radio frequency microneedling, I know that procedure gets a bad name right now, but it really helps give more longevity to results. If you have a facelift in your late 30s, even late 40s, will you probably need another facelift in your life? Probably, but will you need one every decade of life for the rest of your life? Probably not, especially if you're doing a deep plane facelift. The good thing about me being a woman and a surgeon is I put myself in your shoes. So am I already thinking about getting a facelift? Absolutely. Am I already feeling the change of my hormones changing? Of course. And so I don't want you to feel ashamed. If you're thinking about having a facelift in perimenopause, just be sure to go to a surgeon that you trust who's not going to just say yes to you no matter what you say. You want somebody to really evaluate your skin, your tissue, your lifestyle, your downtime, and make sure that this is a smart decision for you. Because this is probably not your last facelift, but it doesn't have to be one of many. If you go to the right surgeon with the right techniques, it should last for years to come. It won't completely stop aging, but you'll always be in a better spot than had you done nothing. So for all you professional women out there, I feel you. And don't hesitate to reach out if you have questions or need advice about whether to move forward or not. Also, don't forget to like and subscribe this channel because I'm trying to produce a lot more videos to help you navigate this crazy world of aesthetics. Again, I'm Dr. Sarah Saxon. My offices are in Austin and Dallas, Texas, and I hope I see you in the office soon.